You have, right? Definitely you too. And you, yeah, absolutely. Okay, well, it looks like we got a lot of new people. That's fantastic. There was about a 2-month break for whatever reason the Oak Ridge Senior Center didn't. Usually they invite me to come give a lecture every month. So I like to be here every month because I have so many topics I like to talk about. So let me introduce myself. My name's Deborah Langhel, and I am a licensed physician, but not in the state of Tennessee. So I'm going to be clear about that. I'm a naturopathic doctor, which is not legally allowed to be a primary care physician in the state. There are 26 states and jurisdictions that allow naturopathic doctors to be primary care physicians, but Tennessee is not one of them. So I'm being very clear, I'm a doctor, Dr. Deb, but I am not a primary care physician in the state, so to be very clear. So I'm an ND, a naturopathic doctor. It's pretty not known here too much in the state of Tennessee because everybody on the West Coast seems to know what an ND is. So a lot of people in Oregon, California, and Washington, you can choose and have your insurance pay for an ND as your primary care physician, which I think is awesome. I believe everyone should have an ND as their primary care physician because they will keep you out of the specialist's office, hopefully. If they do their job right, then you won't need to go see a cardiologist and a nephrologist and all of those things, right? So my education as an ND is almost identical to an MD. So if you look at, I used to show all that, but I wasted too much time. So let's give a brief summary. If you look at the curriculum for an MD, a medical doctor, like a University of Washington, and an ND, it looks almost exactly the same, except NDs, we take a lot more biochemistry, a lot more physiology, a lot more of the sciences, and definitely a lot more gross anatomy and cadaver labs and all that. And the biggest difference is we take 1/3 the amount, so less, of pharmacology. Because I am not trying to get you on drugs, but I do need to know about drugs, so that way I don't cause problems if I give you supplements or I try to wean you off your drugs. So we do take pharmacology, and then I did a lot of extra pharmacology, so I'm actually certified in pharmacology as well as an ND, which some states require that for NDs to take a special board exam for pharmacology to make sure that we understand pharmacology. So I did that.
Where does a DO come in?
Osteopathic doctors, I think started out wanting to be more like, functional medicine doctors, more naturopathic style, but in order to get the schools accredited, it sort of has morphed into more of an MD. So I would say they're much more like an MD than anything else. They might have a little slight natural bent to them, but their training and their curriculum is not like naturopathic medicine. For me, the difference I said is mainly pharmacology is what I took less of, but I've also taken 9 homeopathy courses, 9 botanical medicine courses, 9 physical medicine courses, so tons of other classes that MDs do not take. So it's almost 1 entire year more of education to be a PCP than a regular MD. But all MDs are primary care physicians. We're not specialists. So we can never become like a cardiologist, we are just primary care physicians. And, but if we do our job right, then hopefully we can identify trends and keep you out of the specialist office and without needing to be on drugs. Because we have tons of things in our toolkit, which you're going to find out that are not just drugs and surgery, because that's pretty much the only 2 tools in a regular MD's toolkit, drugs and surgery. Okay, I also, while I was getting my medical degree, I got my MPH, so that's my Master's in Public Health, because I wanted to do this. I wanted to speak to people.
I was going to say, an MPH, what's your specialty in public health?
Master's in Public Health, and the focus was on public health education.
Most epidemiology.
Most people's epidemiology and biostatistics. Almost all Master's Public Health programs are epidemiology and biostatistics. One of the only programs in the country that focuses on public health education is Bastyr, the university I went to. So that went hand in hand with being an ND. So I learned how to educate the public by speaking and stuff like that. All right, and then I got my CHES, Certified Health Education Specialist, because I want to speak. I want to do exactly what I'm doing right here. My goal is to empower people to know that they have options besides surgery and drugs. Some amazing options and inexpensive ones. So you can be your own doctor. And then I also on the project. My former career, I changed careers midlife. So I was a 20+ year mechanical design engineer and program manager in the Washington, D.C. area. And then I decided to change careers midstream, not because I didn't love it, because I did. I was very successful and I loved being an engineer. But I really had a passion for health, and I was seeing all my colleagues dying of heart attacks as they drove to work. And, you know, it was heartbreaking, literally. And so I decided to go follow my other passion. Even as an engineer, everyone called me Dr. Deb at work, but I wasn't actually a doctor, I was just an engineer, but they'd come to me for natural health advice. So I decided, okay, let's just go completely in that direction, see where it takes me. Okay, so here we go. Today, we're doing a lecture that I created called Aging Gracefully. It's very high level, so I could go into the weeds for hours on 6 different topics we're going to talk about today. But basically, you know, there are the top 6 concerns for people who are 65 and older and 85 and older on what causes death. And we're going to talk about what you can do about each of these 6 things at home that will dramatically decrease your risk of dying of these top 6 things. So that's what today's lecture is. So we got a lot to cover in an hour. Okay, so let's keep going. All right, this is my disclaimer that just says what I said earlier. I am not a doctor in this state. I'm just a healthcare consultant. And this is for educational purposes only, because there's always things that are unique about everyone that will, you know, change perhaps how the information is applied. So this is to hopefully help you feel like you can go down this rabbit hole on your own and research some of these things and see if they're appropriate for you. Okay, so naturopathic medicine, we always start, just so you know my philosophy, or our philosophy as a naturopathic doctor, we start at the bottom of the therapeutic order. That's where we always start, which is we figure out how to set the foundation for health and remove obstacles to cure. Because sometimes you can give somebody a vitamin, but if they're not absorbing the vitamin, then taking the vitamin is not going to do anything. So we have to we start at the bottom and figure out what's preventing you from naturally creating balance in your body, and then we use higher and higher force, you know, modalities as we go up. And so that means, you know, even taking botanical medicine is more high up here because it's like a drug, it's just a botanical medicine. We're symptom suppression, you know, or we're trying to, and so no one was born with a valerian root deficiency, you know. So I could use botanicals, and there's definitely times when they're indicated, but I don't like to rely on supplements or even on botanicals as the first thing I go to. Right? I like to use things lower on the therapeutic order. So now you know my philosophy. Our population is getting older. This is just a statistic that's showing that the demographics of our population is changing. And more of us are older relative to the younger people. So we need to start looking at how do we stay healthy as we age. And that's our eye health, heart health, everything. Okay, this is the fun slide here. It looks pretty busy, so I'll try to explain it to you. These are the top 10 leading causes of deaths for 65 years and older. These are the top leading causes of deaths for people 85 years and older. And my main point I'm trying to make here is for both, so for 65 and older and 85, the number 1 is heart disease. The next one is cancer. The next one for 65 and older is respiratory issues, so chronic lower respiratory issues, but it's also number 5 here, so it's still on the top 6. And then there's stroke is number 4 for both. Then we have influenza and pneumonia, which is still lung-related things, so I'm going to put that in the lung category. And then we have cognitive health, so Alzheimer's right here, Alzheimer's. The only one that's totally different is diabetes. So if diabetes is more of a concern for 65 and older, it's going to get you 65. But if you can make it to 85, it's not one of the top things that's going to kill you. Okay. All right, so we're going to talk about these 6 things. So we're going to start with heart disease. Let's see here. All right, so heart disease is a term that encompasses a bunch of different things. So it's all these things listed here, so I don't need to read them, but it includes strokes and peripheral artery disease, any valve issues, arrhythmias, cardiomyopathies, coronary artery disease, so it encompasses all kinds of vascular issues. And we will talk about this. Okay, so this is one of my heroes. His name is Dr. Blanchette, and I love him. And he is a MD, so he's a medical doctor, not a naturopathic doctor. And I still love his philosophy of how he treats. He's treated thousands of people with heart disease, and he's found that there are, in his mind, and he's written all kinds of things, but 2 main things cause heart disease. And if you can, for 90% of his patients, of the thousands he's treated, and if you can deal with those 2, so I'm trying to give you the high yield items here in this lecture, right? You know, and because we can go down deep, but the top 2 things are mouth hygiene, so oral health, hidden dental abscesses, and sleep apnea. And if you can solve those 2 issues, 90% of his patients, their coronary artery calcium score goes down to levels that basically reduce their risk of a coronary event to 0. Right? So he said he's treated. The last time I heard him lecture, It's 4,000 patients he had treated, and not one of them had died of a coronary event. Now, he had had patients die, they died, and some of their coronary artery calcium scores were over 4,000. I'm not sure if you know what a coronary artery calcium score is, but a coronary artery calcium score of 1 is dangerous, right? So if you have 1, you're dangerous. 200, super high. 4,000 is like astronomical. So he won't even take you as a patient unless you have a 2,000 score for coronary artery calcium, which is like you're on death's door, you know, according to regular medicine. And he has not had 1 patient die of a coronary event. But and he uses this philosophy, which is hidden dental abscesses and sleep apnea. And the reason why is because let me go to the next slide. Oh, sorry, I should take this one out. Sorry about that. Okay, here we go. So, what is the link between heart disease and you know, your gum health? What happens is, when you have a hidden dental abscess or gum disease, especially any kind of gum disease, if your gums bleed when you brush your teeth, that's an open wound in essence. And it's a open door for bacteria in your mouth to get into all of the blood vessels that are in your mouth, in your mandible, and go straight to your coronary artery right here, right, to your carotid and into your heart. So what happens is, it's a very short path, you know, for the bacteria in your mouth to get to your heart. It's a very short path. And it causes inflammation of those arteries. That bacteria, so they have actually done DNA analysis of the plaque in your carotid artery. Okay, and the DNA analysis proves that the bacteria that causes your carotid artery to get blocked is from your mouth. It's oral bacteria, right? So that's how important oral hygiene is for your heart health. So I don't care if you have pretty teeth, I could care less. What I care about is that your oral hygiene is impeccable so that way your heart stays healthy. So if your gums are bleeding, you've got to fix it, because that is just letting the bacteria go straight into your coronary arteries, right? So there's a lot we can do about that. And so it's also, this book was written by another doctor who was one of my heroes as well, Thomas Levy, and I got to speak with him personally, 3 different conferences, which is awesome. And he has a whole book talking about hidden dental abscesses and how what happens is when you have a root canal, and it doesn't even have to be a root canal, it can be just an infected tooth and it has no pain. You don't even know that you have a hidden, that's why it's called hidden. You don't know you have the abscess. It will drip pathogens from the root right into the arteries, which then goes to your carotid. And so it's like a slow drip of pathogens that'll cause you eventually to have a coronary event, or at least it raises your risk of a coronary event dramatically. So mouth health is huge. And let's see here, let's go on a little bit. So this discusses it in pictorial form. Bacteria in your mouth basically sticks to the fatty plaques and it contributes to the blockages. And that's just what I just said. So, okay, so this is just a picture to show you that this inferior alveolar artery, which is right near the roots of all the teeth, come up and go right to the internal carotid and the main carotid, right? So it's just a very short path. Okay, so next picture right here. So what can you do to help it change and make more healthy the microbiome in your mouth? Because we all have heard about the microbiome in our gut, but we also have a microbiome in our mouth. And in my mind, that's just as important or more important, since heart disease is the #1 killer. Okay, so there's lots you can do. It's been proven the best way to change the bacteria in your mouth to make you not have periodontal disease or plaque or tartar and all the different issues that happen, cavities, is just change what you eat. That's the #1 way. There are indigenous cultures and aboriginal cultures that don't brush their teeth at all, and they don't have any cavities. They have no history of cavities in their cultures at all, and they don't brush their teeth, right? And why is that? That's ridiculous. Doesn't make sense. Well, it's because of what they eat. So the #1 way is to change what you eat. Now that's hard because we all get in the habit of we eat what we eat. I brush my teeth, I'm going to tell you, because I eat carbohydrates and I eat largely, in some ways, you know, a Western diet. I don't just eat meat, you know, from whatever, you know, thing I've hunted. So I definitely recommend brushing your teeth. So, but the #1 way is to reduce your carbohydrates, and definitely don't eat carbohydrates before you go to bed without brushing your teeth. So if you're going to sneak a little sneaky snack before you go to bed, and you're going to eat a cracker or 2, you better brush your teeth, because that's the best #1 way to all those carbohydrates that you just ate from that cracker is going to stay in your mouth and be a perfect environment as you sleep all night long to create the bad bacteria, right? So, okay, another thing is you gotta remove the bad bacteria. So brush, great. Floss, I use a water pick, and I even take it with me traveling. This is my traveling water pick right here. You can like pull it apart, and it has this little water pick that you can use. So I have my home one, and then I have my travel one. And then use a tongue scraper. How many of you have heard of a tongue scraper? Okay, so absolutely super awesome thing to use. Your tongue has a ton of bacteria on it. So every time you brush your teeth, after you rinse your mouth out, this is a copper one. I love copper because it's antibacterial, so it actually gives you even more of any copper that gets scraped off this onto your tongue. And you basically just scrape your tongue off, and you'll be surprised how much comes off of it. And so I just do that once or twice after I brush my teeth. So easy to incorporate into routine, works great. How many of you have heard of oil pulling? Yeah, oil pulling is really great too, especially if you have gum issues, like your gums are inflamed, or your dentist says your gums are starting to recede. You need to get the health of your gums better, and one of the best ways to do that is with oil pulling. And oil pulling, you'll have to look it up. So this is, like I said, we're going to stay high level, but this is my little jar that I take with me when I travel. I have a bigger jar at home, and it has coconut oil in it. Now you can use sesame oil as well. And you basically put a little spoonful in your mouth and hold it in there. You're going to get, if you look at it online, you're going to see all kinds of different numbers of how long, but it's long. So 10 to 15 minutes, you want to hold it in your mouth. And so I usually do it in the shower, so I'll put it in my mouth right before I jump in the shower. I'll jump in the shower, I'm washing my hair, whatever, and it melts, the coconut oil will melt in your mouth, and then you pull it through your teeth. So you're like sort of swishing it around in your mouth. Do not spit it down your drain, because you're going to clog your drain with the coconut oil, because it will re-solidify, right? So you have to spit it in the trash can. So just remember that. Unless you use sesame oil, which is more liquid, and then it probably could go down the drain. Indians, the Indian culture, they use sesame oil for oil pulling, but I love coconut oil because it has an antibacterial quality. So I have a twin sister, and she had such bad gum disease that she had to have antibiotic shots in her gums, and I got her on this protocol, and her gums are fine now. So it definitely works to heal your gums. Her dentist couldn't believe her gums were like regenerating, which they say is impossible. Like, you can't unrecede your gums, and she's had a huge luck with it. It works really well. So oil pulling is great. And then another thing you can do, especially if you have gum issues, this is xylitol powder. I have big jars of it because I buy it in bulk. You can buy it from Amazon in a big bag. I recommend everybody have xylitol powder in their house because it's good for a lot of different things, and I'll explain it. But I use it, you can add a little bit to your coconut oil, right? So what happens is I'll get my little spoon, it's a tiny little teaspoon or so, right? Because your saliva will mix with it, and if you put too much coconut oil, you're going to find that your mouth is too full. So use a small amount, okay? So I get my little teaspoon, I get my coconut oil, and then I dip it in my xylitol powder, and that's what I put in my mouth for my oil pulling. Because the xylitol is not, it's a sugar alcohol, so it's very sweet, so it makes it taste good, which is nice, but it's not a sugar alcohol I recommend ingesting, so don't swallow it. It's not going to kill you if you swallow it. It is, you'll find it in gum, chewing gum, xylitol is in chewing gum, but almost all sugar alcohols cause digestive distress. And so that's why I don't recommend you swallow it and like put it in your coffee as a coffee substitute, sugar substitute, or anything like that. The main reason why I recommend xylitol in the oil is because it's an anti-adherent specifically for oral pathogens. So the bad bacteria in your mouth that you're trying to create an inhospitable environment in your mouth for the bad bacteria, right? But you want the good bacteria to proliferate and be healthy. Well, this is the bad bacteria in your mouth hate xylitol. It absolutely hates it. So if you use this, it will kill that bad bacteria. So let's say you're in a big hurry and you're traveling and you don't want to brush your teeth, but you have a nice big carbohydrate meal, pizza, and you're just going to go to bed because you're too lazy. Then at least put a little xylitol in your mouth, swish it around with your saliva, and then spit it out, because it will kill the bad bacteria, so you won't create the bad bacteria, So very, very good for, and that's why they put it in gum now, is specifically because it's so good for killing the bad bacteria in your mouth. So really good. It's also super good for, and I'm just going to add this in here, these days sinus infections have been going around like crazy, right? And there's a particularly tenacious one that's going around here these days. And people can have it forever. And so I make a homemade nose spray. I didn't bring it with me, where you put just water, a saline water, so I put salt in it, and I make a saline water, and I put 4 drops of iodine in it, and I put a half a teaspoon, so not very much, xylitol powder in it, and I mix it up real good, and you spray it in your nose. It's awesome, because just like the bacteria in your mouth don't like the xylitol, the bacteria that's coating the inside of your nasal sinus cavities don't like it either, and it will release. It's an anti-adherent for that bacteria, and it will help you get rid of the sinus infection, even the very, very tenacious ones. It's one of the only things that I found work well for everyone. So, and if you can buy it too. You can get online. There's a nose spray called X Clear or X. It's like, just type in nose spray X Clear in Amazon, and you'll see and it's basically just xylitol water with saline, and they don't even have iodine in it, and they'll sell it for $20. But you can make it super cheap on your own, like super cheap, because this whole thing is just a couple bucks for a whole huge bag of xylitol powder, right? You can make it for the rest of your life because you don't need that much. Okay, so. Okay, how do you support the mind? So we're talking about xylitol powder, chewing gum after meals is great with the xylitol in it. Use mouthwash. So the mouthwash I like is this right here. This is a gum guardian. So you can also put this in your oil that you swish with. But I'll be honest with you, now that my gums are healthy and everything, I don't do this all the time. I only do this periodically. But if you have a gum issue, do it every day. Try to do it every day while you're in the shower until your gums are super healthy, and then you can just do maintenance. But this sometimes I'll put on my toothbrush or in a glass of water and swish it around. This has a lot of herbs in it that are antibacterial, and it'll do the same thing as like the xylitol. But I'll be honest, the xylitol is way cheaper and probably even a little more effective than even the botanicals in this gum guardian, right? That's my whole thing is how do I give you things that are cheap and easy to do at home that don't cost a lot of money? So that's it. And then, believe it or not, the bacteria in your sinuses contribute to the bacteria in your mouth. They're like, it's all connected. So you got to figure out how to, like, if you have a sinus infection, that could be contributing to your bad breath. If you have bad breath, it's one of the #1 causes of bad breath is sinus infection that you don't know you have. One of the reasons why people get sinus infections is because they have a hidden dental abscess in their upper teeth. Right? So that pathogen is going, and so then it causes a sinus infection that will never go away. And it's because the abscess in the tooth is causing the sinuses to get infected. So if you have a chronic sinus infection, I highly recommend you did a 3D cone beam scan. You can ask your dentist for a 3D cone beam scan, and they will look and see if they can find any hidden dental abscesses. And like I said, this book, where did the book go? I don't remember. Oh, here it is right here. He talks about 3D cone beam scans and how basically this particular doctor believes that the hidden dental abscesses are the #1 cause of heart disease. He believes. Now, Dr. Blanchett is the doctor I like, and I like his dual theory of it's sleep apnea combined with oral hygiene. And, okay, so yes, I'm belaboring some points. So get a 3D cone beam scan, especially if you have chronic sinus infections, because it's usually a big contributing factor. All right, so now sleep. Sleep apnea was the second thing for heart health, right? So sleep apnea is when you're not basically getting enough oxygen. And there's different kinds of sleep apnea, but basically, because some people they wake up constantly, so they're never getting any deep sleep because they don't realize they're waking up all the time with, they're not quite breathing well, and so then they shift a little bit, and it's all sort of unconscious. So if you don't have a lot of delta wave sleep, then that contributes to your cognitive health, and it's huge. But it also contributes to the inflammation of your arteries, because the lack of oxygen inflames your arteries, and any inflamed arteries, it becomes more sticky for coronary artery calcium and lipids to stick to. So you don't want inflamed arteries, and that's what the sleep apnea is doing. The sleep apnea is making you not have enough oxygen, and that lack of oxygen is causing a systemic vascular inflammation, which is making your arteries sticky. Okay, and so we don't want the stickiness, and so that's why you want to sleep well. So how do I do it? Sleep is my #1 health issue, at least these days especially. And so going to bed as early as possible is super helpful. It maximizes your delta wave sleep. So people say, yeah, but I will go to bed at midnight and I'll wake up at 10, and so I get plenty of sleep. I just like to go to bed at, a little past midnight or 1 a.m. Well, it's been proven in study after study that almost all our delta wave sleep happens early, regardless of what time you wake up. Like, it doesn't matter. It's not the block of sleep. It's your circadian rhythms. It has something to do with the light, and when the sun goes down and when the sun comes up, and so if you can go to bed, like for me, I found that if I go to bed 9:30 and I'm asleep by 10, I will maximize my delta wave sleep, because I wear a ring called an Oura ring that tracks my delta wave sleep along with my other kinds of sleep, which we're going to talk about in a second. But definitely maximize your delta sleep, because Delta wave sleep is like a pressure washer for the brain, and it actually removes the amyloid plaques from your brain. And it's the only type of, because there's REM sleep and there's light sleep. There's all different cycles of sleep we go through every night. We do this cyclic pattern, and our deep sleep is longest, our first cycle, and then it gets shorter and shorter and shorter as the night goes on. That's how the delta wave sleep works. And so you definitely want your best sleep at the beginning and early as possible. Okay. And then we already talked about your microbiome, but this is your gut microbiome. There's actually even probiotic pills you can get to support sleep. So I think it's interesting. I'll be honest with you, I've used them and I haven't seen a difference in my sleep, but definitely having a healthy, diverse microbiome in your gut will help you sleep. And then make sure you're getting enough air. So if your sleep partner, tells you that you're snoring, then you're not getting enough oxygen, right? That's just the fact of the matter. So you need to you got to do something to get more oxygen. And if you don't think you're ready for a CPAP, or there's no way you can wear a CPAP, which is the things that force oxygen and air for you, then which is my #1 recommendation if you have sleep apnea. But you can also get a mouth guard. And it's not for grinding your teeth. It just adjusts your jaw position just a little bit so it doesn't close the airway here. So a lot of people are able to wear these little slim mouth guards, and they got some really slim ones now. And they're custom made, and then you can adjust it on the side, and then you can get a lot more air. And then keep your room temperature low. That helps people sleep a lot. For me, I'd say one of the #1 things I've done that's helped me sleep now that I'm in menopause is I got a chili pad. So have you guys heard of a chili pad before? So sometime I'm going to come here and do a whole lecture on nothing but sleep because it's so important. But it's a mattress pad that you roll out and put on top of your mattress pad, but it's not thick, it's thin, like a little thin thing, and it has water circulation that goes through. Okay, and then and then there's a little box that's on the side of my bed below the bedside table, so it's hidden, and I can set the exact temperature. And if I set it at 67, 66, 67, it will suck the heat out of me like you wouldn't believe. And keeping my skin temperature cool has been the #1 thing to help me sleep. It's like a godsend. I'm so happy this product exists. So it's called a chili pad, and it works fantastic if heat is your problem, which it is for me. Okay. Because I like to bundle up too. I don't want to have my room temperature super cold. I want the room decent temperature, but I want my body cold. So anyway, so that's why the chili pad works for me. Okay, so now we're going to talk about cancer.
Can we ask questions?
Absolutely.
About sleep apnea?
Go for it.
Okay. I have trouble with my CPAP lately because of breathing issues. And
yeah.
I saw yesterday where in the video where if your mouth opens while your sleep apnea machine is on, that contributes to cavities. Are you aware of that?
So I have not heard of having your mouth open contributing to cavities. In fact, I would have suspected the opposite because oxygen will kill the bacteria.
That's with your sleep apnea machine.
Yeah, but you're still having oxygen all in there, right?
But you're not supposed to open your mouth with your CPAP machine on.
I've not heard of it contributing to cavities. I'd have to look into that,
Okay.
I would say at first glance, from hearing what you're saying, if a CPAP helps you sleep, does it help you sleep, typically?
Yeah, not so much. I mean,
Okay.
it's, I hate those masks.
Yeah, so I would try mouth guard for you then. I would, there's a bunch I can talk to you later, and if you send me an email or, because anyone who's put their name on the list will get this presentation, a copy of it. So when I send you the presentation, just write me a question and say, can you send me the link for the mouth guards? Because there's several different companies, and you'd have to talk to your dentist, I believe, and you can get a mouth guard fitted for you. That's not for grinding, it's for repositioning your jaw to keep your airway open. And you might find that works better. I know a lot of people at the clinics that I've worked at in Washington, in the state of Washington, that worked way better for them than CPAPs, because they couldn't stand having this thing on their mouth, face. But don't stop, make sure that you have a solution to your sleep apnea. It'll be one of the best things you can do for your heart health, for sure. So, yeah. Yeah.
Just a couple more if you don't mind. My doctor gave me that X clip.
Ah, mm-hmm.
So can you add iodine to that?
I do.
We knew.
This is for educational purposes only, but that's what I do. Yeah, I use like normal, like I would, if I bought the X Clear, I would pull the top off. You can usually gently pull it off, and I would probably add 4 or 5 drops of povidone iodine to it, just the brown stuff you get for $6.45. You can get a 2% or 10%. You know, if you have the 10%, I think that's what they're selling at Walmart right now, really inexpensive. You know, 5 drops is fine. You could do 3 if you wanted to, just to make sure it doesn't irritate your nose. But that's just going to contribute to killing any of the bacteria in there. It's not going to hurt anything.
Okay. And I missed the one where you had glycine, take glycine before.
Oh yeah, did I have that up there? I'm trying to go through quickly. Yeah, I recommend that for almost everybody. Like, you know, especially if sleep is an issue. So younger people in their 20s and 30s, maybe not. But glycine is an amino acid. So it's just food. I would call it steak, because most of our amino acids come from meat, right? So glycine is steak, but I'm simplifying it. It's one of the amino acids that is typically in meat. And it's sweet. It's very, very sweet and naturally sweet. And, you know, it's in a lot of bodybuilders, you know, thing, because it helps build muscle, right? So it's great for building lean muscle mass. But one of the benefits of glycine is it helps muscles relax, right? So it's really good for older folks. I'd say anybody 50 and older. It's a great idea to just put a teaspoon in your chamomile tea before you go to bed and eat it, drink it. It's a food, basically. And I have some samples here I can show you guys, and you can taste it. But it just helps you sleep. And some people, it's dramatic. Like, I told them, just try this to help aid in your sleep. And it, like, they couldn't sleep for 20 years, and now they're sleeping, you know. So it really, really works for some people. For me, it's mildly helpful. So, but, you know, it's definitely something, even if you don't have trouble sleeping, if you know, as older women and older men, you know, we don't have as much testosterone and other things that help us keep our lean muscle mass. It's one of the best supplements you can take to help keep lean muscle mass so you don't lose it with exercise, of course. Yes?
I've just been diagnosed with enlargement of the lower part of my heart.
Okay.
It's very mild. Is there any way to reverse that?
You know, maybe we can keep the questions till after the presentation.
Hold that thought, okay? Hold that thought. Ribose, D-ribose is really good, but if I forget, write me an email or talk to me afterwards, and I'll definitely talk to you. There's things you can do to help your cardiac muscles. I don't know about reverse, but I can tell you things that help. So, okay, let's see here. Let's keep going. So, some of this is all what we would standardly expect to see for how do you reduce cancer risk, but I'm going to go into some other details here. Cancer does not like an oxygenated environment, and it doesn't like a basic environment from a pH perspective, so like acid and base, right? So it likes no oxygen, and it likes acidic environments. So if you can make your body an inhospitable environment for cancer, you want to have oxygenated tissues, hyperoxygenated tissues, and you want to have a little bit more basic alkaline environment compared to acidic. So on those two premises is a lot of what this is based on. Now, I'm going to start here with foods that have been proven in lots of studies to have an anti-cancer promoting effect. And some of them you may have heard of, some of them you not. Broccoli sprouts, the chemical constituent in broccoli sprouts is called sulforaphane. It's a hard word to pronounce, but it's been proven to be amazing at creating an inhospitable environment for cancer. Apricot kernels, it's also in apple seeds. Have any of you guys heard of laetrile or amygdalin? It's an interesting chemical constituent that's in apricot kernels that's highly cancer fighting. And I can send documentation, but we're getting low on time, so like I said, I'm just hitting the top of the skimming the surface here. And then modified citrus pectin is absolutely fantastic for breast cancer, absolutely fantastic. You can get chewables, and they're tasty, and basically it's just the white rind of citrus fruits, right? But you can get them distilled into little chewable tablets if you're not going to be regular about eating the rinds. So it works really great. And then parsley has apigenin in it, which is a chemical constituent that's highly anti-cancer fighting. And 1 teaspoon of dehydrated parsley a day has been proven to be therapeutic dose, which is nothing. So like I make in my household, we call them Deb's parsley sprinkles, and it's just dehydrated parsley, and then we mix all kinds of other stuff with it, like nutritional yeast powder, and we put mushroom powders in it and other things, and we just sprinkle it on things like anything, like, you know, whatever our vegetable is, or potatoes, or whatever. We just sprinkle it on everything to try to get our 1 teaspoon a day, if we can, of parsley. Right? Just because I believe in trying to use food as medicine as much as possible, and less of the supplements, you know, because if we can get it from our food and make it a habit, it's healthier. Okay, then you want to oxygenate your tissues, because that's going to create an inhospitable environment for cancer. So the best way to oxygenate your tissues is to exercise, right? Exercise, you create the carbon dioxide, and that's what the carbon dioxide is a physiological trigger that pulls oxygen to that area. So if you're using your leg muscles, you're using up oxygen, and carbon dioxide is created, you know, as a consequence of your ATP, using ATP, and then that carbon dioxide will pull oxygen from the blood. The hemoglobin will release oxygen based on how much carbon dioxide is in the tissue. So in one sense, carbon dioxide is an oxygenator. Does that make sense? You know? So because carbon dioxide in the tissue is the trigger that lets the hemoglobin release the oxygen to the tissue. So, you know, people think, so for example, a lot of people who have cancer, they'll do H-spot, hyperbaric oxygen therapy, where they lay in a chamber and they just lay there and they breathe concentrated oxygen. And I get that, and I've read the studies, and, you know, I think in some cases it's helpful, but really you're laying there not moving, which means you're not using any of your muscles. So you're not creating carbon dioxide in those tissues, so there's no trigger to pull. So the hemoglobin in your blood's not broken, right, when you have cancer. So now you got I'd like to talk about, imagine your bloodstream like a highway with a bunch of cars. And all the cars can hold 4 people, right? And that's, each of those cars represents the hemoglobin with 4 oxygen molecules, okay? And so if all the cars are full, because your lungs are working and your lungs have properly loaded all the cars, what tells the car to get off the off-ramp and release the oxygen? Like, what says, okay, you can get off now, right? So having a good blood oxygen saturation, when you put the oximeter on your finger and you have 98 blood, you know, oxygen, you're like, great, I'm fully saturated. That just means all the cars are full. Great, all the cars are full, but that doesn't mean the cars are going to let the oxygen off to the tissue that needs it, right? So you have to figure out, okay, great, so oxygen saturation is one thing. You got to have the oxygen in the cars, and they're there. But now you got to release it. So what tells you to release oxygen to a tissue? And that's carbon dioxide in that tissue. So, for example, let's say you have skin cancer, right? Or you have a hereditary predisposition towards skin cancer because your mother had it and your father, something like that. And you're worried that you're going to have skin cancer, right? And you want to reduce your risk of skin cancer. Hyperoxygenating your skin is a great way to do it. Well, how do you hyperoxygenate your skin? You take a carbonic acid bath. And carbonic acid baths is really easy to do. It's just a bath bomb. You know those bath bombs you get? You put them in and they fizz in the water? That's carbon dioxide. All those little carbon dioxide bubbles are going to stick to your skin. And if you stay really still and you don't push them off your skin in the bathtub, that carbon dioxide is going to tell the oxygen in all the capillaries and the blood vessels that are close to your skin to release oxygen to the tissue. And so it will hyperoxygenate your skin doing one of those baths, right? Because the carbon dioxide is telling the hemoglobin to release the oxygen at your skin. Does that make sense? Okay? So supermodels use it to get rid of cellulite and for anti-aging. They'll pay tons of money for carbonic acid bathing. But you can do it with a bath bomb. Only thing I don't like about bath bombs is they put all this other crap in it that stinks. So I try to make my own bath bombs because it's just citric acid and baking soda to a particular ratio. And then, so you can just put it in your bathtub and swirl it around with your hand, and then the bubbles will start coming up. And you can make your own carbon dioxide bath, right? And then you don't have to pay $100, $200 to go to a supermodel place to do it, right? You know, it's very inexpensive and cheap to do at home. Or you can exercise too, but if skin is where you want the oxygen, then you put carbon dioxide on the skin, and the best way to do that is in a bathtub, right? So that's just one example of how you can use carbon dioxide to hyperoxygenate your tissues, okay, of a specific sort. So let's say, you know, for example, people have diabetic foot ulcers, or they have a foot ulcer they can't heal because you're not getting oxygen down there because of the diabetes has caused problems. How do you heal the diabetic foot ulcer? Or let's say you have venous stasis ulcers in your feet or on your leg, a venous stasis ulcer. Get a bath, you know, a little bucket, right? Put citric acid and baking soda. Just look up what the right ratio is online, right? Or talk to me later. And then put your feet in it, right? And it has been proven in studies. I can send you the studies. It looks like black toes on people regrow almost completely. Like tissue that you thought for sure would need to be amputated, it's gangrene, it will grow back. Because the oxygen, any of the blood vessels that are still healthy, right at the end of the dead tissue, will start seeing that carbon dioxide and dumping oxygen there. It'll just dump oxygen, right? So carbon dioxide foot baths are one of the best things to do for diabetic foot ulcers and venous facies ulcers. But all of this is, how does this apply to cancer? For cancer, you want to get it inside your body, the carbon dioxide, and the number one way is exercise. So I recommend EWAT, that's exercise with oxygen therapy, and that's basically where you're jumping on a trampoline or you're riding on a little recumbent bicycle, stationary recumbent bicycle, and you breathe concentrated oxygen while you're riding your bike. Okay, and so then there's a new form out that's even better, where you can take that off and you actually put an air restrictor on, right? So now you're filling all your tissues with carbon dioxide because you're not getting enough oxygen for like 30 seconds to a minute, and then you put the concentrated one on, right? And so what happens is you're like squeezing all the oxygen out, and then you're flooding it in. It's like squeezing a sponge out, and then, right? You know? And that's how you hyperinfuse all your tissue with oxygen, and it creates an extremely inhospitable environment for cancer. So it's really good for people who, you know, and a lot of athletes are now using it because it does all kinds of other awesome physiological effects for rapid recovery and removal of lactic acid and other things. So athletes use it all the time, but it's been used all over the place for cancer too. So, okay. Ketogenic, low sugar and low carbohydrates. Cancer loves carbohydrates, so if you can go ketogenic, that's even better. And then, you know, try to become metabolically alkaline. That's a whole. You can do baking soda stuff, baking soda baths. That's a whole other story. You can Google it. Like I said, I'm trying to just touch on the high level. I can do a whole lecture on each of these. And eat live fermented food. If you can create a healthy, diverse microbiome, it will create an inhospitable environment for cancer. So don't underestimate the microbiome in your mouth and in your gut and on your skin, all of that. It really makes a big difference. And then try to reduce any toxin exposure. And so doing what I would call a lifestyle detox program is really important. And that could be sauna bathing. Some people hate heat though, but I love saunas because it relaxes me because I tend to be hyper. You probably didn't pick up on that. And so like exercising, sweating is really detoxifying, and there's tons of other things that chelate means bind to heavy metals that are lodged in your tissues and pull them out slowly and safely over time. So instead of doing like an IV, you know, there's very harsh ways of getting chemicals out of, you know, toxins out of your system, but the way I like to do it, and that I personally use as my own personal detox, so we're always exposed to toxins all the time, and heavy metals. It's just, you're not going to get away from it. I use spirulina and cilantro. Those, over time, if you take them and eat them, it's like I take them in tablets, because some people make smoothies in the morning and you can put the spirulina powder in it. It's very dark green. You can get blue spirulina as well. And cilantro is even more effective, and it will bind to heavy metals over time and pull them out of your body safely. And I say that safely because if you mobilize heavy metals out of your fatty tissue, your adipose tissue, too quickly, because that's where they like to hang out. They like to hang out in your fat, right? And if you mobilize them too quickly, then they're in your blood, and then they lodge into the next fatty tissue they can find, which is often your brain, right? And then they'll cause brain problems. So you don't want to go see a naturopath, and a lot of naturopaths have gotten bad reputations because they use a very quick program to get the toxins out of your system, and it ends up causing more problems like Huntington's disease and Parkinson's and tremors, because now it's in your brain, the toxins, right? So I prefer using food as medicine and doing it slowly over time as a lifestyle habit, right? So spirulina and cilantro are great. They will slowly over time pull heavy metals out, and you'll be able to excrete them safely without them causing havoc elsewhere, right? Okay, so let's keep going. All right, so let's see here. All right, so how do I prevent cognitive decline? So a lot of this stuff is going to look the same, and that was my point. My point was some of these all look the same. So we've already talked about sleep. It's one of the best things is get deep sleep, right? Because it's like a pressure washer for your brain. It removes the amyloid plaques, right? Dental and health and hygiene, super good. And then all the regular things that you would think of. But let's keep going. What did I have here? Bacteria in your mouth can affect your brain, right? So once again, I'm going back to oral hygiene, and I'm going to go over some more stuff that I have for oral hygiene, and then how your sleep affects your brain, right? And says, even one night can lead to an increase in the beta amyloid protein that's associated with Alzheimer's. And so deep sleep, the delta wave sleep, is the sleep that removes those plaques. Okay, so let's keep going. This is just talking about how inflammation, so systemic inflammation in your body causes cognitive decline. It's one of the causes, you know. And how do you reduce systemic inflammation? One of the ways is by not having a slow drip of pathogens from a root canal tooth or a chronic sinus infection. You might even have the sinus infection because of a tooth, right? So, and then the low oxygen from not sleeping well causes systemic inflammation of your arteries, which makes them sticky. And if they're sticky, you don't get blood flow in your brain, you don't get blood flow in your heart. Okay, so let's keep going. All right, so this is a diet that I really like. I don't like to say the word diet, because I'm not a big fan of any diets, right? Like, because it means I like to think of this is just what you eat. Whatever you eat is what you eat, and that's good. But if there's guidelines you can follow that are more helpful than others, I like to, you know, explain those. And this particular diet is called MIND, this Mediterranean Intervention for Neurodegenerative Delay. And it's a very interesting one because basically this is the diet right here. It's sort of, and it's really just guidelines, right? And but they have found that using these guidelines right here, it significantly lowers your risk of cognitive issues. You know, it will help your cognitive longevity. And so I like this one, and this is what I try to follow. This is the hardest one, I think, for me to have learned, like, to get into my lifestyle habit. But now, I'd say, thanks to my family, who my mother is a big supporter, and so we're good. We make dark leafy green salads every single day for lunch. And I'm not a big salad fan, but I've learned to be a big salad fan, mainly dark leafy green salads, because it's so important for your cognitive health. And it actually helps with, like, diabetes and other, prevention and that kind of thing. And so I try to mix my salad up by putting different stuff on it. I'll put palm hearts or artichoke hearts or, carrots, and we just change it up. But I always try to have a healthy nut on there and a healthy oil. So sometimes I'll put pecans, and sometimes it'll be, walnuts or pine nuts. But I just choose a different nut, and then I choose a different oil. So I'll use olive oil one day, and macadamia nut oil one day. I have pistachio oil I'll use. So I have a whole slew of oils to try to make the salad more interesting. But that's how I get my healthy oils and follow this diet thing. And otherwise, nuts, that's how I get my nuts, is I put it on the salad, So it's just, it's hard to get into the habit, but it's actually not too bad once you get used to it, and it's healthy in 1,000 different ways, so I highly recommend looking into it. Okay, this is an interesting guy. He's also an MD, but I consider him an honorary MD because he's pretty awesome. And this book, if you're going to look at a book or want to read a book on, using natural approaches to natural interventions for reducing your risk of Alzheimer's or even trying to reverse it, he's done some amazing things. He did some published studies that got him really famous that talks about basically a multi-pronged approach. So he uses like 14 different interventions together to reverse Alzheimer's, and it works. And that's why he's so famous. It works really well. In this book, so then after he did these published studies, where with people that he in his own clinic, then he wrote this book, and that got him even more famous. But it's a really, really good book, and it's all natural stuff that we've talked about at this lecture, which is why I really love it, because but it's hard. This is only one study. This book is only based on one study, so other epidemiologists might say it's not enough to make a conclusion, and that's true. But the way our randomized double-blind studies go, it's really hard to separate out the threads of like 12 different interventions all on top of each other. It's just impossible. So it's almost impossible to prove a lot of naturopathic interventions because they're so intertwined with other things, and it's just impossible to separate them. But anyway, it's a great book. I love it, and people have really good luck with it. All right, so this is talking about how even obesity has been found to be associated with cognitive decline, so getting your weight, under control and optimized is good. Okay, so here's some of the things for preventing cognitive decline. Blood sugar regulation is big. So if you don't know what your blood sugar is, I wish I think everyone, including kids, should learn how to use a blood glucometer because it's so important. And kids nowadays especially eat tons of sugar. But a lot of people don't even know what their blood sugar is after they eat certain meals. And you might be surprised. You might think you're eating super healthy, but that meal is dramatically raising your blood sugar and you don't know it. And the only way to know is to prick your finger. You gotta prick your finger and you gotta check it. And then you'll learn, oh, I do okay with this, but I don't do okay with that, right? And then you can start optimizing, and you want to cut your highs and lows off. You want to get that, so your blood sugar doesn't spike really high. You want to get the highs lower and the lows higher, right? And that's what you're going for. And for a while, when you first learning to do blood sugar regulation, even if you're not diabetic, I think everybody should do this because it's good for cognitive health. It's very, very good for cognitive health. Is get a blood glucometer, they're cheap, and just check it after things. Like what I learned was I can eat a chocolate bar, a dark chocolate bar, and my blood sugar's fine. But if I eat, and that's with sugar in it, not even with like a sugar substitute or whatever, it's starch. But if I eat one slice of bread, through the roof. And it doesn't matter what the bread is. Whole wheat, doesn't matter what the bread is. If it's bread, one slice, man, that's the number one way for me to get my blood sugar up is bread, right? So, and rice is not as bad for me, especially if I mix it with an oil, but like I had to learn all this, and it's different for everybody, right? So, I remember in medical school, I was sitting in this classroom, we're learning endocrinology, class, and they're trying to teach, and all my classmates are younger than me, because I was an older student, and they said, oh look, Deb, there's this bar they're selling in our little store that had this health food, and there's like a protein bar. Like, this is safe to eat. This won't raise your blood sugar. I'm like, are you kidding me? It'll absolutely raise your blood sugar. They didn't believe me. I'm like, okay, we're going to do an experiment. And so I came to class, and they gave me the bar. And we're all in the lecture hall, right? And so we're just whispering to each other. And I pricked my blood sugar, and I proved to them that I was low. I was hungry, right? I was like, I don't know. I can't remember what hungry was for me at that time. Because I'm pretty stable in my blood sugar. And I said, normally, and so one day I ate what I normally eat, which is like a bag of nuts. That was what I'd snack on in class. And then they got to see, and then I pricked my finger, and they could see what it was. And I don't know, it went up to 105 or 6. It was not much of a difference, okay? So then the next day I did the same thing. I'm like, okay, here I am. I'm at 98 or 96. I'm hungry, right? And then I ate 2 bites of the protein bar, right? And then I waited 5 minutes, and I was at 125. Then, 10 minutes, didn't eat any more of the protein bar, just 2 bites. It was up to like 146. That's crazy high. And that's a protein bar. That's a protein bar. So, like, the only way you're going to know what makes your blood sugar spike is by checking it, right? Because my classmates were like, no, this is low sugar. This is not going to make your blood sugar spike. You got to test it. You got to really figure it out, okay? And that's going to pay off in terms of your cognitive health because you'll know, right? All right, so then we already talked about all these. I use, for sleep optimization, I use this Aura ring right here. That's what this is right here. And, it'll tell you, this was just a screen capture I took offline somewhere. I've showed mine before, my actual one of the lectures, and it's dramatic. All my deep sleep's right here. And none's over here. This person can get I'm impressed that they can get any over here. But normally these deep sleeps are big, and then they get shorter and shorter as the night goes on, so you don't get any deep sleep at all later. And this person only got 36 minutes though, and I recommend about an hour is really healthy of deep sleep. Okay, so let's go on to the next one. Where are we at on time? Okay, we got 5 minutes. All right, this happens all the time. Okay, so now lung issues. I'm just going to call them lung issues. Is another one of the top 6 things that cause death in people 65 and 85 and older. All right, so lung health, I think, is really underestimated in this country. We're all used to hearing about hearts, and we're used to hearing about all kinds of other health issues, and diabetes, but we don't really think about our lungs a whole lot. And so that's why, if you've gone to any of my lectures before, I've given 2 different lectures on air quality, because it's so important for our lung health. And our cognitive health, believe it or not, because carbon dioxide in the bedroom is usually so high, especially if you have 2 people in the bedroom and there's no ventilation, because it's like, you don't need it for whatever reason. If you test your carbon dioxide in your bedroom, it will go way up. And that will, over time, you're sleeping a lot of hours in that room. You're like a fish in a fishbowl, right? That's a lot of hours you're sleeping in there, and you're not getting enough oxygen. So it's going to cause inflammation. And when you have systemic inflammation, it's going to lead to a whole host of other problems, right? Including cognitive decline. So you really need to make sure the oxygen levels in your bedroom are good. And it's easy to detect those. I brought in a bunch of monitors before to show you how these little inexpensive monitors can tell you where you're at. But the main thing is, If you can open your windows, you know, and let fresh air in, that's great. Even cracking the window a little bit will let enough oxygen in to solve that problem. But also clean air. So like, what are the toxins in the air? Like, there's particulate matter, there's VOCs, volatile organic compounds. There's just a lot of stuff that has to do with air quality that you can affect by different plants in your room, different HEPA filters, and these kinds of things. Okay, so third leading cause of death, and if you looked at that chart, they had separated out chronic lower respiratory infections from influenza and pneumonia, but that's all lung stuff. So if you combine that, we're up to the third leading cause, right? So that's how they got third here, and it was different. They just combined all lung things for this. And it's just, it's just tough, because people don't realize their indoor air quality is way less healthy than outdoor air. But we're indoors 87% of the time. 87% of our lives is indoors. And so you need to start looking at your air quality. And those of you who've been to my other lectures, you know I'm passionate about air quality. Okay, so how do you deal with COPD? This is a lot of, you know, the things we've been talking about. Exercising, you know, vitamin D, I can talk about that for a long time. Avoid infections. So, like, for me, with all of the viruses that are going around these days, this is a little handheld nebulizer, right? Let me stand over here. And I take this with me anytime I travel, and you put water, you can put water in here, so I put saline in it, and 1, maybe 2 drops of a 2% povidone iodine, and then you close it, and you turn it on. I don't have water in it right now, and you just hit go, like the button right here, and it does a small particulate matter, and you can breathe it. So after talking about you all today, I will be going home and breathing steam, because I want to make sure I have not contracted anything in my lungs, because a lot's going around these days, right? And I want it in my nasal passages. After I come home from church, I use it, right? Anytime I'm around a lot of people, I will breathe steam that has saline and iodine in it. And this has been in published medical studies. Dr. Brownstein's awesome. He's an MD, and he uses this to treat people with COVID. This is what he uses. So, and I can send you the study if anyone's interested. You can just put it on a little sheet, say send me that study. But I take a little thing like this with me, even traveling. And my one that I use at home looks more like this right here, right? And it has a little water well on the bottom, so you put the water in here. And then you can put salts in it. I always like salt, because salt is very antibacterial. It'll kill a lot of stuff. And then I put a couple drops of iodine, and then I just turn it on, and I'll breathe for a while, right? So this is the one I use in my bathroom. But I always travel with it too. And here's my little iodine that I bring with me everywhere, so I can control my drops, because if you use the one from Walmart, you can't control the drops. You know what I'm saying? It's just like a squeeze bottle, and you need to control the drops. You need a dropper. That's important. And then this is my little salt, my neti salt, and I use my salt to rinse my sinuses out as well. So if you have sinus infections, let's see here, I was going to show this one. I thought I had another one. This one's not open yet. Yeah, here we go. So how many of you guys do saline flushes, like for your sinus cavities? Excellent, good job. So you can get this at Walmart. This is really inexpensive. I think it's $9 now, but it was $6. I mean, everything's gone up in price, crazy. But all it is, just so you know, is this bottle right here, right? That's really squeezable. So it's a really soft bottle that has a tube that goes all the way down to the bottom, right, like this. And then it has this tapered end. And so all you do is it has a whole bunch of these little packets of saline that are pre-measured. But you don't have to use this. You can use a bottle, like, you know. And you open the packet, put it in here, fill it up with water. I put 1 or 2 drops of iodine in it, too. That's what I do. Then I put my finger over the top and I go like this. And I make sure it's all the salts mixed in well. And then you put it up against your nose and you just squeeze it. And in one squeeze, I can get like half the bottle to go through my nose, and it flushes my sinuses out. And then I'll, you know, blow my nose with a tissue, and then I'll do the other side, right? And it goes through this way. And you can do this in less than 30 seconds. And it's just as important as brushing your teeth. It will keep your sinuses clear. It will get rid of sinus infections. There's so many things that healthy that it does. So, and it will prevent you from, you know, C19 especially, COVID-19, loves to adhere to the mucosal membrane of your sinus cavity. That's where it likes to stick. And it sticks there and then it starts proliferating, and then you inhale it into your lungs. But if you can get it out of your nose first, all the better, right? So I don't go anywhere without this. This is like my toothbrush, right? Now, my twin, she was traveling recently, and she forgot her neti pot. And so you can get, you know, just those water bottles that have the little tapered end on them, the little white tapered end. And I said, go to this, you know, thing. She was waiting for her airplane. I'm like, go buy a water bottle that has that little tip, and go get a bunch of salt packets from the vendors that sell food, and she used that as her neti pot, right? I'm like, you have to, especially when you're traveling. That's when you get exposed to this stuff, and then you gotta get it out. You gotta just flush it out. It'll reduce your chance of having a sinus infection or contracting any viruses when you travel dramatically. So I highly recommend that. Let's see here. And it'll keep your lungs healthy, because then you're not going to be inhaling it into your lungs. So back to the lung thing here. Vitamin D, I want to talk more about that. Most people are overdosing on vitamin D right now, and it's unhealthy. So how many in here take D3, vitamin D3? Yay. Okay. How many take K2? Yay. Excellent. What about A? Okay. All right. So what happens is D3 is really effective. I mean, it's awesome. It will raise your serum calcium like this. It's just going to raise your serum calcium. So any food you eat that has calcium, you're going to get it. It's going to be bioavailable, which is what you want, especially if you're, older. You want bone density. You want to be strong. That calcium's great. But the problem is, it's raising your serum calcium, which means the calcium in your bloodstream. The calcium in your bloodstream is Ca+2++. It's very sticky, right? It's very sticky. So it wants to go somewhere really bad. It's like trying to find someone to hold hands with. Well, if it doesn't know where to go, if you have chronically high serum calcium and the calcium doesn't know where to go, then it's going to stick to your arterial walls and cause calcification and hardening of your arteries. And it's going to increase your risk of a heart attack or coronary event, right? So it's really dangerous, in my opinion, to take D3 without K2. Vitamin K2 is like its partner in crime. And K2 is another fat-soluble vitamin that will recognize the serum calcium going through your blood, and it'll bind to it, and it'll take it to where it's supposed to go, right? It's like the chaperone with the calcium. And not only is it a chaperone, but the K2 wants the calcium so bad that if you happen to have calcification in your valves of your heart, or calcification, you have a calcium oxalate kidney stone, or you've got calcium where it shouldn't be, which a lot of us have calcium where it shouldn't be, it will slowly chelate it. The K2 will. It'll pull